All right, I have verified the doctor's order here and compared it to the patient's MAR, and she does not have any urinary strictures that would prevent a urinary catheter, so we'll go ahead and get started. Hello, Miss Kitty. My name is Audrey. I'm going to be your nurse today. How are you doing? Can I go ahead and verify your name and your date of birth on your band here? All right, perfect, Miss Kitty. And do you have any allergies? You don't. Well, we just want to make sure and ask and double check you don't have any iodine or shellfish allergies today because we're going to be using iodine. No? Okay, that's great. Well, if it's okay with you, we're going to go ahead and get you laying down in a recumbent position so that we can get ready to get started. Do you have any questions before we start about what we're going to be doing today? The doctor has ordered that we do a urinary catheter to help with some of your distension and issues urinating. So we'll go ahead and start with the bladder scanner to make sure everything looks okay. Can I help you into a lower position? All right, go ahead and lay you down and pull this back. And we will first start with a bladder scanner. So we would check and palpate, and if needed, do a scan of the bladder right here, which is a little distended, which will be helped by the urinary catheter. So we're going to go ahead, Miss Kitty, and put this towel under you to help catch anything and make sure that we keep your bed nice and clean and dry. And then I have some warm soapy water here, and I'm going to go ahead and put on some clean gloves. And we'll get you washed once with the warm soapy water. So, fold this here in the water. And then, sorry, I got this on my wrong hand here. We will fold this with this hand. And I'm going to go ahead and spread apart your labia, and we will clean first on this outer side over here, and then get it clean again, readjust our towel, and then we will be cleaning on this inner side, and get the cloth wet again, and then we will clean right down the middle here, straight down. Alright, we'll discard that and take off these gloves. Okay, so now I'm going to go ahead and get your kit ready. So just hang out there for a minute, and I'm going to inspect our catheter, Foley catheter kit here. Make sure that it's not damaged in any way, doesn't have any water, it's nice and dry, so we are good to open it. Go ahead and pull this out. Paper aside. We're going to use this as like a little trash can area down here so that we don't break sterile field once we get started. So I'll just make a little place for that. And then we're going to open our kit this way and then this way, only touching the one outer inch and the one outer inch. And then right here, we would just use the flap and then square the kit away. Then I'm going to crane in and grab the drapes and the gloves and set them aside. For this top drape, we'll be putting the shiny side down. So I'll fold it into my hands like this, and we're going to tuck it up under you. There we go. All right, next I'm going to do hand hygiene again, and then I'll put on these sterile gloves so I can get your kit all ready. So again, the sterile gloves are clean. I'm only going to touch this outer 1 inch here. we have our sterile gloves on, we will, I'm sorry, that glove ripped just a little bit, but we're still keeping sterile field. Have our sterile gloves on. What we're gonna do is go ahead and turn this square, and we're going to empty the lubricant out so that we'll have that all ready to go when we're ready to do our catheter here. So we're gonna dump all that lubricant in there, and then move these forceps, pour the iodine all over the cotton balls, and we'll dispose of that. Reach back in here. This is our lubricant. We'll drop that in there. And then we're going to set this to the side, but keep that outer 1 inch. And next we're going to take this wrapper off of the catheter slowly. Doesn't touch anything else. And we'll drop that into our garbage. Now we're going to connect this so that when we're ready to inflate the catheter, we will be good to go. We'll drop that in there. And we're going to attach it right here. And set that back in there. Now that our kit's ready, we'll go ahead and stick this back on top. We're going to pick the whole kit up. Put it right on top of this sterile area here. And we will make room for ourselves. Scoot this down underneath here. Sorry, this is not for the video, but we have to scoot back a little bit. Our bed's not quite long enough. All right, here we go. So that would have been done before. Now we have enough room to work, so we're going to, again, clean. Once I touch with this hand, then I will keep only this hand in sterile field. So I have my forceps, and I'm going to pick up the sterile cotton balls and wipe. So we'll go ahead and spread this back, spread the labia back, and pick up a cotton ball. And we'll start again on this far outer edge, down to front, we'll drop it. Around the sterile field, go back in, get a cotton ball. We'll go on this other side over here, down the back, go around the sterile field. We'll come in here, go straight down the middle. We'll do one more, since we have one more cotton ball, go back in, go straight down the middle there. We'll just drop all the forceps in there, and then we will pick up our catheter. So we have this, and our lubrication is all ready here, so we'll dip that in there. We're holding it about 5 inches back, and we're going to go ahead and let that drape out just a little bit. And we're going to insert the catheter by crawling our hand back until we see urine. And now I see urine, so I will insert 1 more inch, and then I am going to hold the catheter with this hand, and then take this hand to slowly inflate the balloon. Go ahead and okay, now that that balloon is inflated, I will pull back a little, make sure that it's nice and snug, and it is. So I'll stop, push it back in 1 inch, and then I can remove this, and I will drape the bag below the bladder. Oops, not quite hold there. We're going to drape this bag below the bladder so that it can run properly. I'll hang it on the side of the bed here. I'm going to remove these gloves and then do hand hygiene and put on some more clean gloves so I can clean up the rest of this here. How are you doing, Miss Kitty? Does that feel all right there? All right, so we have new clean gloves on. I'll go ahead and take this tray and all this under here. We will remove this towel as well. Put that in the linens. And then with this clip here, we'll go ahead and clip it to the sheet so it stays in place. And we will secure this here to your leg. We'll use a little tape to keep it in place. And it's important to keep it on top of your leg, not under your leg, so that the catheter can keep flowing freely and there won't be any blocks. Take this trash here, and then we can go ahead and stitch you back up. We're going to raise the head of your bed, and I'm going to lower the bed all the way back down to keep you safe. The bed's locked. I'm going to put 2 side rails back up, and here is your call light. If you need anything, you can call me and let me know, and I'd be happy to help you. And let me know if you feel any discomfort or need anything. All right, thank you, Miss Kitty.